Understanding adamantinoma. Where does this bone cancer come from? Imagine a rare type of bone tumor that grows slowly and often quietly in the shinbone. That's what adamantinoma is. It is a very uncommon cancer that starts in the bones, mainly in young adults between 20 and 40 years old. It is more common in men but can affect anyone. Despite being called a bone cancer, it makes up less than 1% of all primary malignant bone tumors. Scientists are still trying to understand exactly where adamantinoma comes from. One of the most accepted ideas is that it develops from epithelial cells. These are cells that normally line surfaces like the skin or the inside of the mouth and other organs. During early fetal development, some of these cells might get misplaced inside the bone. Over time, these misplaced cells can turn into tumors. This theory is supported by the fact that adamantinoma often appears near the surface of the tibia, the main bone in the lower leg, where the bone is close to the skin. Advanced imaging and immune testing have also shown that the tumor contains epithelial cell features, reinforcing this idea. There's also some discussion about a possible link between adamantinoma and a benign bone condition called osteofibrous dysplasia. This condition affects the same bones and age groups and causes bone deformities. Some researchers think that osteofibrous dysplasia might sometimes develop into adamantinoma or share a common origin. However, this connection has not been definitively proven yet, and more research is needed to understand if and how these two conditions are related. Genetic factors and DNA changes are also being studied as possible contributors to the development of adamantinoma. Environmental influences like exposure to chemicals or radiation do not seem to be linked to this tumor. Unlike many other cancers, no specific risk factors or causes have been confirmed for adamantinoma. Clinically, people with this tumor might notice a painless or painful lump in the affected bone. Sometimes the swelling can cause redness or deformity, like bowing of the lower leg. In some cases, the tumor weakens the bone enough to cause fractures. Because adamantinoma grows slowly and does not respond well to chemotherapy or radiation, surgery is usually the main treatment. Surgery often involves removing the tumor and some surrounding tissue, and in severe cases, amputation might be necessary if the tumor involves critical structures. In summary, adamantinoma is a rare bone tumor that likely originates from misplaced epithelial cells during development. Its exact cause remains unclear, but ongoing research aims to better understand its origins. Early diagnosis can be challenging because it grows slowly and may not cause symptoms right away. Surgery remains the primary treatment, and timely intervention offers the best chance for a good outcome. If you or someone you know has concerns about bone tumors, it is important to consult a healthcare professional for personalized advice and appropriate testing.